Town Hall. People's Town Hall is a nonpartisan, nonprofit organization dedicated to the simple idea that our democracy is stronger and better when our elected leaders take regular occasion to meet with and listen to the people they work for, their constituents. So we are in Multnomah County, Oregon today with Senator Ron Wyden. This is his home county and the home of Portland, Oregon, the most populous city in the state. So we received dozens and dozens of terrific submissions. We did our best to select a handful of questioners here for the town hall that best represents the topics we saw. We do not ask people's party affiliation. We do not ask who you voted for or whether you even voted. So we just tried to get a sample of the issues that matter to folks. We hope to have some time near the end of the program to get to your questions if you're watching on Facebook Live. Use the comments there to ask a question, and we'll hopefully get to a few of those as well. Now, we received these submissions over the last few days. The news breaking this morning, of course, that President Biden has nominated Ketanji Brown Jackson to the Supreme Court. We don't have a question about that, but Senator, I wonder if you're able to react to that to get us going.
I'll start with that, and I just want to thank everybody for participating. It's a gorgeous day, a little cold, but wonderful to be outside. And I'm sitting in my dining room in Southeast Portland. What I like to do is have one of these meetings and go shoot some hoops at Dunaway. So it's great to be with everybody. The president has followed through with a commitment to make sure that the court is more diversified in the future. And I have voted for Judge Jackson once, and I think Judge Jackson illustrates the principle that diversity and excellence go hand in hand. She is a very experienced jurist. She's been a public defender. She's been in private practice. She's been in government. And obviously, what will happen now, I, as a United States Senator, will get a chance to provide my advice and consent. I look forward to meeting with her. I have questions on a whole host of issues, but I'm very, very much look forward to voting for a nominee who's experienced, who has the kind of core values with respect to equality and democracy that are so important to Oregonians. And why don't we use that as a kind of opening take. Nathan, do you want to go through some of the other kind of procedures for today, or would you like me to start?
No, we are happy to jump into questions if you're all set.
Yeah, and I'll just be very, very brief. This is part of a pledge that I made to Oregon when we were choosing our first new United States Senator in quite some time. I said I'd throw open the doors of government and have an open to everybody town hall meeting every year that I serve in the Senate. Every county, I'm from Portland, love Portland, but I'm not a United States Senator from the state of Portland. So this is about getting to every nook and cranny, and it's great to be home and to have a chance to listen to all of you. And I regard these town hall meetings as really what public service is all about. We are all sitting inside, and we're 3,000 miles away from Washington, D.C. And a lot of folks in Oregon think that sometimes Washington, D.C. might as well be Mars for all the connection it has to their lives. And so we use these town meetings. Yesterday was number 1,000. So I guess we're on 1,000 plus one today. Is we use them for you to educate me. And I'll just close by way of saying that I've especially come to feel in the last year. And I've had 970 in-person town hall meetings. For the last couple of years, we've driven out to the counties, been physically there, take questions, and newspapers. People have learned a lot about the Hermiston Herald, Madras paper, and others as we gathered there to field questions from county residents. I believe these town hall meetings provide a common space, a safe space for Oregonians to express their views. What went on in Washington, D.C. on January 6th was not legitimate public discourse, as some have said. It simply wasn't. I saw the violence that was directed towards overturning a constitutionally mandated procedure. And so we're going to offer a very different alternative today, something that I think is the Oregon way. And no subjects off limits. Nathan, let's just start covering everybody's questions.
Terrific. First up, we have David.
Thank you, Senator Wyden, for taking my question, and thank you for doing the town halls and letting people ask questions. I'll try to ask, I have a two-part question. I'll try to ask it quickly so others can talk. The Radiation Exposure Compensation Act, RECA, is up for renewal. It applies to people who've been exposed to radiation from the various tests. I'd like to see it renewed and also applied to people who helped with cleanup projects out in the Marshall Islands, especially the latest on Eniwetok, which is still incompletely, in my opinion, cleaned up. I don't apply, or I wouldn't qualify for any benefits because I was a Peace Corps volunteer out there and was not involved in any of the cleanup project. I also want to thank you for working behind the scenes, I suppose, in trying to get Medicaid eligibility to Micronesians and Marshallese. I think that's very important since they do have a COFA agreement, which they don't have very good health care out in the Marshalls or Micronesia in general. As you know, COFA negotiations haven't or have been stalled. They really need to resume. Representative Porter held a hearing on the Runit Dome on Eniwetok, and it received very little attention, whereas China and if I want to, I don't know if the right term is threat to our homeland from China, the Marshalls were more than once said how important they are to us. So I would like to see some importance or some priority given to the appointment of a special envoy to get the negotiations going. So I'll leave it there and let you respond. And thanks again for.
Thank you very much for bringing up the Marshall Islands and the inadequate removal of radioactive materials. I have, in fact, been very involved in this because as chairman of the Senate Finance Committee, we have jurisdiction over Medicaid. And I worked very closely with Senator Schatz and Senator Hirono of Hawaii to really start the ball moving with respect to Medicaid. Here's where we are, though. What the United States did to the Marshall Islands, in my view, is beyond shameful. Testing nuclear and biological weapons using the residents as unknowing guinea pigs. And then to top it off, they lied to the inhabitants afterwards. And our country's made only a partial effort to correct the wrongs. As the island became a sovereign nation, there was a cleanup effort, a compact was signed to allow the Marshallese to travel to and work in the United States. But it's clear those efforts really aren't holding up. So the containment of radioactive waste in the Marshall Islands is threatened, a variety of factors there, climate change, and the Marshallese working in Oregon and elsewhere continue to hit roadblocks, constantly. So that is why I made mention of pushing very hard to help with respect to getting health care. And here in Oregon, we've helped with all kinds of efforts in terms of assisting migrants, driver's licenses, and others. But as the compact comes to an end, which is really what you're talking about, I think it's past time for the country to create a newer, fairer compact that really would let the Marshall Islands truly recover from the damage the U.S. Inflicted. And we have a significant number of Oregonians who are affected, and they contacted our office, know of our work with Medicaid, and why don't you just convey, we'll get the message out as well, for all those who'd like us to follow up on specific matters, just have them leave a phone and an email with Nathan, who does a very good job of following up, and we'll be in touch.
Awesome, thank you.
Thanks for joining
Thank
us
you.
today, David. And I'll send your info along to Senator Wyden's team. Next up, we have Betsy.
Hello, Senator Wyden. I'm Betsy Zucker. I'm a retired family nurse practitioner in Portland. I worked for many years at the Portland VA Medical Center, and I have a question about Medicare. I'm very concerned about the pilot program within traditional Medicare called direct contracting, which is further privatizing Medicare. This program, slightly modified and renamed REACH for 2023, undermines patient choice, decreases transparency and accountability, and increases costs to taxpayers, all so that Wall Street can profit. Senator Wyden, I wonder if you'll join Elizabeth Warren in calling for an end to this program. She recently held a hearing about it. Thank you.
She held a hearing in the Senate Finance Committee, and I said I thought it was important that the issues be raised there, and we wanted to make sure that she got a hearing in the full committee that I chair, just for the reasons you're talking about. There's a lot of concern about this whole effort and what it is, so we'll kind of walk people through it and what my concern is. It comes from the Medicare Innovation Center's work, which they would like to have as direct contracting. A lot of ideas out there to improve America's healthcare system. I personally feel very strongly about more Medicare type choices, approaches like a public option, approaches like lowering the age of eligibility for Medicare. So there are a whole host of issues. And by the way, I wrote the section of the Affordable Care Act that gave states a lot of freedom to be flexible. It's called Section 1339, but it had a crucial provision that I'll never let anybody fudge, and that is all the guardrails in the ACA in terms of coverage and consumer protection are intact with 1339. You get to go out and suggest you got other ideas, fine, but you're not going to fudge on the coverage and you're not going to fudge on the consumer protections and that kind of thing. So we're trying to right now get some clarity on how this differs from Medicare Advantage. Medicare Advantage, Oregon has one of the highest levels of senior participation in the country, our state, in terms of elderly people participating. And it's programs that, Oregonians probably don't even know what all the underpinnings of, but it's something like Kaiser, which many Oregonians are proud of. We were one of the ringleaders years and years ago. So we'll be happy to follow up with you and get your ideas. And the first question I have is, what's the difference between this and Medicare Advantage? Medicare Advantage does allow a private insurer like Kaiser to play a role in the delivery of healthcare. I think that's been a good thing. I think Medicare Advantage, because of the core requirements, has been a good thing. I also wrote the Medigap law, which is primarily for people who don't take Medicare Advantage, and that has strong consumer protections. And it, for a lot of people, is very appealing because it's considered more simple than a lot of the procedures. So we're going to get to the bottom of this. And I feel very strongly, I'll close with this. Healthcare has to be a basic human right, period, full stop. It's what made me go into public service. I was director of the Great Panthers for almost 7 years. And I said, if you don't have your health and your loved ones don't have your health, everything else goes by the board. So I'm all in on this, and any details that you'd like to have, examined on this, be happy to do it. Glad you have background in this. And that's the first question. What's this different in terms of how it's laid out than Medicare Advantage? Because Medicare Advantage was something that was it was reviewed for a long time, examined with respect to how there would be additional choices. And this stems also from the fact that no national system, neither the Canadian or the British or the French, no matter how extensive the role for government is in their healthcare, has said there should be no private sector offerings. That's why we have Medicare Advantage. Now, this new thing, I don't know how it works, and I want to get the details, and we'll report to Oregon. We'll report back to Oregon right away.
May I make just
Of course.
a response?
Yeah, of course.
So one of the things we know about Medicare Advantage is that it allows a choice of insurance companies, but that implies a narrow choice of a network of providers. Traditional Medicare allows a Medicare recipient to utilize this public program with full choice, number one. So there's increased choice of medical providers in traditional Medicare without Medicare Advantage. And in addition, the research shows that privatization, including Medicare Advantage plans, costs more than providing the same services to the same cohorts of people as traditional Medicare. Costs more. The administrative percentage is much higher in Medicare Advantage plans, and in direct contracting is allowed for the financial middleman to take money out of our public coffers. So both of those issues are ones that concern me about both direct contracting, which inserts just a financial entity in between the patient and the provider, and Medicare Advantage also. I understand some of the advantages, but it does not increase choice for the Medicare recipient, except of plans, not of their healthcare. So thank you for this opportunity to bring this question forward.
You raise very important, issues, Betsy, and I look forward to working with you on it. My wife always says, don't get my husband talking about healthcare, because all you'll hear about is all these things going back to Gray Panther, days, because I think this is the most important issue. So let me unpack a couple of your comments. You also raised the question of what does this mean for direct contacting mean for Medicare Advantage, and you're not wild about both. I understand the point. I also feel very strongly that not all Medicare Advantage is created equal. I've seen some absolutely disastrous Medicare Advantage plans. And when I'm out talking to seniors across Oregon who have Medicare Advantage, like a Kaiser plan, they'll tell me, hey, I kind of like it. So we got to get, to the bottom, of this. My Healthy Americans Act proposal in 2009 was my first choice with respect to the ACA. And it basically said that everybody in America who wasn't on Medicare ought to have coverage like their congressperson. And people would come up to me and they'd say, Ron, I don't know exactly what you guys have, but if you guys have it, I want it. And so we're going to continue this debate. And now with the Affordable Care Act in place, to me, and this is what I've said on the Finance Committee, where I have many colleagues who want more Medicare type choices. My first option is going to be the public option, lowering the age of eligibility. These will be Medicare type choices. I think there'll be a lot of support for it. Most of my colleagues on the Democratic side want to see it. And we're going to look very carefully at this whole direct contracting, idea, because I haven't seen much in the way of consumer protections here. We're going to get to the bottom of it and be glad to continue the discussion. And just know the reason I'm in public service is because I believe a just America gets every single person decent, affordable coverage. And I'm going to stay at it as long as I'm in public service.
Thank you.
Thanks for joining us, Betsy. Next up, we have Angela.
Hello. Hi, Senator Wyden. I am Angela Perry. I am involved with the Oregon chapter of American Foundation for Suicide Prevention, and I have a multi-part question for you. We know that the Suicide Hotline Designation Act, the switch over to 988 is supposed to be this July. I do know that a lot of states are struggling to find funding, and there's still pieces of legislation working in individual states to finance that. So my first question is, how do we ensure that there is funding in place across the country for the switchover? And then second question is, in Oregon, we have an amazing youth line. Is there a part of the Designation Act that allows the youth line also to be expanded? Because we know youth tend to connect more with youth. So when they're seeking help, and with the pandemic, we know that's needed, is there going to be an option for a nationwide youth line? And then last question is, once they connect with the crisis line, how do we ensure they have follow-up care through medical coverage? Because especially for rural Oregonians, there's not a lot of options for mental health providers. So how do we ensure that people are able to receive the care that they need?
Angela, thank you so much for raising this issue. I'm also very grateful for your work with our office. I know you participated in a press conference a bit ago, and I'm going to set the table on this mental health issue for just a quick moment, and then, mention your points, the question of the suicide line, the 3-digit, number, what we could accomplish with a special youth line, and then the follow-up services. But let's set the table. We know we had a serious problem in the mental health space before the pandemic. Since the pandemic, the needs for mental health have gone into the stratosphere, and no group has been more affected than young people and their families. And I have been working now for months to build a bipartisan coalition in the Senate Finance Committee to really do something about it. And there is not a moment to wait. I don't know if you picked up, but the Surgeon General came to our committee recently, and he said, this is a painful data point, I'll never forget him saying it. He said, on average, it is 11 years between the diagnosis of symptoms and the person actually getting mental health care. 11 years. We would never accept that in the area of physical health. Trace Terrell, I think you know him. He's in Lymphedema. He's doing a wonderful job advocating for young people there. He appeared at the hearing. And Trace said that at his school in Lymphedema, 80% of the mental health referrals in his school by students went nowhere. So we really have a big, big challenge here. I'm all in. This is enormously personal to me. My brother was a schizophrenic. For years and years, he'd be on the streets, and the Wydens would go to bed saying, we're worried Jeff is going to hurt himself or somebody else. So I have never been more determined to put together a major set of reforms. Our ranking Republican on the Finance Committee is Mike Crapo of Idaho. Terrific guy, very, very conservative. He and I wrote the transformative forestry bill to end this discrimination against fire prevention, landmark transportation law. We worked on a whole host of issues where we found common ground, and I believe we're going to do it again. Apropos of each of your points, the suicide 3-digit hotline for suicide prevention is urgently needed. We're seeing particularly increased pleas from young women who are contemplating suicide. We're going to make sure that we get those funds, up and running under the National Suicide Hotline Designation Act. That's what establishes 988. Easy to remember, 3-digit line. And by the way, I'm not giving up on the idea of the private communications companies chipping in some more dollars to this, because they benefit from so much in terms of people paying for their services. You ought to give a little something back to help communities, particularly rural ones. And by July 16th, dialing 988 will direct callers to the National Suicide Prevention Line. Texting the number will also be an option. Vets have a dedicated crisis line. I also believe, apropos of your second point, very strongly in the youth line, which Trace talked about with the Senate as well. I also, and I'm so glad you raised this today, I'm so glad that you're focused on what to do after the immediate intervention, because what we learned with Dr. Guthrie, the Surgeon General, and we also learned last week, is that in a lot of communities, if a student, for example, has a tremendous anxiety attack, for example, during school, they'll go to the hospital emergency room. A, those providers aren't really trained to deal with mental health, but B, there's nowhere for them to go when they have had the immediate intervention. I mean, in Eugene, there are no beds for that kind of treatment. So I'm going to be focused on earlier interventions, better crisis care, and getting more, providers and services in the kind of context that you're talking about. Because, what you really need is a continuum of services from the time you and Trace and others, youth lines and the like, hear about the problem, all the way to the time when the young person, when they and the family are at wit's end, goes to the hospital emergency room, they need a kind of treatment space after they've been in the hospital emergency room. Because in a sense, what I'm told in Oregon, a lot of the emergency rooms just sort of keep people, not indefinitely, but for a long period of time. And I said, well, where do they go? I said, well, eventually you find a place for them to hang their hat, but they're often coming right back. So, Angela, 3 cheers for you. I'll make you and Trace a presidential ticket because he was great at the hearing. You've been great now. I want you to know this is going to be right up at the top of the list of my priorities. And I haven't even mentioned the insurance companies, because I think these insurance companies that are supposed to be complying with the parity law that requires mental health be treated like physical health, they honor it more in the breach than in the observance. And I don't mind saying in Multnomah County, I got contacted by OHSU not long after the pandemic, and they said they couldn't get their claims paid. And I said, well, what's the problem? I said, well, the insurance companies they don't have any staff, they don't have any this, they don't have any that. And I said, sure sounds to me like another bunch of made up excuses. So we got together with the good people at the psychiatry program up at OHSU. And I made some calls. We announced an investigation. Oregonian had a little write-up, Ron Wyden doing an investigation. And a few weeks later, floods of money came in to pay the bills because they knew that somebody was kind of watching it. And I said to my colleagues on the committee, that is not a mental health program for all of us to go out and kind of see if the insurance companies are doing as bad a job as we think and then holler about it in the newspaper. That's not a program. I'm glad that OHSU got the bills paid, but we need a real enforcement plan. And by the way, nothing I've talked about for the response to you is partisan. The mental health parity bill, we all practically cried in the Wyden household when we saw Pete Domenici, a really conservative Republican, and Paul Wellstone, late Paul Wellstone of Minnesota, just about the most liberal guy in the Senate, they came together. It was a historic day, and I'm not going to let the insurance companies fudge on it.
Well, thank you so much, Senator Wyden. That definitely answered my question. I know we have a lot of work to do, and any way that I can help or be involved, I would love it.
You go, Angela. We're all in it. And if you and Trace run for president together as a ticket, I'm all in. You got one of you decide who's president, the other who can be vice president.
Sounds good. Thank you so much.
Thanks a lot. Great work.
Thanks for joining us, Angela. Next up, we have Kevin.
Good afternoon, Senator Wyden. I'm thankful for the privilege of being able to talk to you today. My name is Kevin Mansfield. I'm here representing. I'm a public policy ambassador with Michael J. Fox Foundation, as well as a facilitator with Parkinson's Resources of Oregon. I have Parkinson's going on 21 years now. And I appreciate working with you and your staff for the last 8 years. You've been behind us 100% on different subjects and things that have come up. Today's topic that I would like to talk to you a little bit about is telehealth. Telehealth has allowed people with Parkinson's, such as myself, to access the care that we need, including mental health services from the safety and privacy of our homes. It is important to me that this access is maintained even once the COVID-19 public health emergency period expires. Currently, the telehealth and other waivers and flexibilities that have been implemented during the PHE remain in effect. I would like to know if you will support legislation to make permanent, or at the very least extend these telehealth flexibilities before the PHE period expires, so their impact can be studied without disputing patients' access to care. Patients and healthcare providers need certainty about the future of the telehealth and patient access. Ensuring patients can access the care they need to diagnose the threat of their Parkinson's is a top priority for me. This is currently legislation in the Senate to do that. The Telehealth Care Access Act of 2021, which was S2061. I request that you review the legislation and let me know if you will support it. Older adults, such as myself and many others that I have talked to, and specifically those with disabilities, are at high risk of serious illnesses if infected by COVID-19. Older adults account for 80% of the COVID-related deaths. Allowing patients to access the care they need from the safety and privacy of their homes can be the difference whether they are exposed to the virus. I would like to know if there was somebody that I could be best contact for me to follow up with on these issues, telehealth and mental health. I am eager to be a resource to your office and help you understand how they affect people with Parkinson's in the community. I want to thank you again for this opportunity. I enjoy all of your town hall meetings, meeting with you in Washington, D.C., and also all of your aides that I'm able to work with.
Kevin, thank you. And thank you for being such a strong advocate in an important area. Yes, we'll get other staff folks to talk with you. And if you can tell us who you talk to, and I can just get your phone number, we'll set that in motion. Let me set the table on this telehealth issue, much like we did on mental health. When the pandemic hit, the country really wasn't very prepared to look at ideas for using new technologies to address how patients wanted to get care and to do it in a cost-effective way. And Seema Verma was then the head of the Center for Medicare and Medicaid Services in the Trump administration. And she called us up and she basically said, hey, I'm going to use the telehealth model that is in the Chronic Care Act law that you wrote, Ron, with Orrin Hatch before he retired. This was hang on one sec. We just got, hold on one sec. I can't hear. One second. So, Kevin, what we're doing is building now on what got started in the spring of 2020 as we started dealing with COVID, and the Center for Medicare and Medicaid Services put in place the program that you like, that you've described as being very helpful to you. And it was really based on what I had in this legislation with Orrin Hatch. And I sort of shoehorned it into the CARES Act. And that's how it became law. The question becomes, where do we go from here? And obviously, I want to strengthen it. I had one hearing already on telehealth. And for example, there are a number of communities that don't have broadband, and they think it's going to be so long till they get broadband. They would like to have the option of audio only telehealth. So what we are doing is working through those issues. But it would just be a huge waste of innovation and investment to just go back to the pre-pandemic rules with respect to, telehealth. I'm not going to let that happen. And I'm very interested in working with you on your ideas to build on the progress that's been made during the 2 years of the pandemic. And frankly, a lot of patients have told me they just wouldn't have been able to get care in anything resembling a timely fashion without the rules that were put in place early in 2020. And we're just going to keep building on it.
Thank you. I appreciate your support in this, and I look forward to working with you and your staff members.
You get us a phone number and an email, and we'll be back at you quickly. And if you can even just give us a name in terms of who you talk to in the office, that'll help as well. But we're involved in this right now. And the message I've said is build on the progress that was made during the pandemic. Don't tear it down. We have a lot of built-in interest since they really took the model from the law that Chairman Hatch and I wrote, and then I got it into the original CARES bill. So we'll look forward to working with you. Another important cause for Oregonians.
Can I send the information to Nathan?
Yeah.
Yeah, you'll just send it. Nathan will follow it up.
All right, thank you. You have a great day.
You too.
Thanks.
Thanks for being such a strong advocate.
Thanks for joining us, Kevin. Next up, we have Judy.
Senator Wyden, thank you for taking my question. It's much less specific and personal than the others, and it has to do with foreign affairs a little bit. I wondered, could you explain the Biden administration's decision to give 9/11 families half of the $7 billion in Afghan funds that were frozen by the U.S. as we left Afghanistan and the Taliban took over? I understand that we don't want the Taliban to access these funds, but it seems to me the money belongs to the Afghan people who are starving and desperate amid the disintegration of their country. If we can contribute $3.5 billion through humanitarian agencies, why not the whole $7 billion? It feels wrong to me, and I wondered if there's background information that I just don't understand.
Well, it is a complicated issue, as so many are. And, I feel that these are two very deserving causes, helping the families of 9/11 victims and helping to support Afghan families. I think it was the president's judgment that half the money from the Afghan central bank would go to the 9/11 victims, the other half to support Afghan families, because without it, the funds would have just been tied up in courts. For years, the families of the 9/11 victims have been seeking financial compensation from the Taliban for years and years. This is a start. A large portion of the funds will still be used for humanitarian needs. I obviously feel so strongly about the typical Afghan getting assistance to avoid famine after devastating recent events. And we've got to get that money out to people and not into the hands of the Taliban government. So I've been pushing hard to get the Biden administration to focus on humanitarian aid for Afghanistan, on ensuring the flow of assistance directly to Afghans, on education access, food security, obviously a pressing issue. And this is a long way of saying that what I'm interested in is not pitting, one very deserving group against another. We've got to get both significant help, and that's what I'm trying to do.
Thanks for joining us, Judy. Next up, we have Jamie.
Hi, Senator Wyden, thank you for meeting with us today. My name is Jamie Eisenstein, and I live in Southeast Portland too. I am a 10-year breast cancer survivor and a member of the Lymphedema Advocacy Group. I wanted to speak with you today because 40% of breast cancer survivors, including me, and 15% of cancer survivors overall develop a lifelong chronic condition called lymphedema as a result of cancer treatment. Having lymphedema means that I am at high risk for infections and other complications. I must be diligent about controlling the swelling in my affected arm and hand in order to reduce these risks. And the most important component of my treatment is the use of doctor-prescribed medical compression garments. Unfortunately for me and millions of other lymphedema patients, these medical compression garments are not or barely covered by insurance. As such, I cannot afford to buy more than one set every year. This means my compression garments are stretched out and no longer as effective. They have unsightly stains and tears between the fingers like this on the gloves. And so that as my hand swells throughout the day, my skin painfully bulges through these holes. Despite my efforts, I usually suffer from at least one cellulitis infection per year. If I was able to control the lymphedema better with properly fitting new compression garments, I would not be as susceptible to these infections. And my insurance would not have to pay for these emergency room visits. Due to COVID, I am even more worried about developing an infection when now is not a good time to go to the ER. I know that you are chair of the Senate Finance Committee, and I want you to know that there is a bill before your committee called the Lymphedema Treatment Act that will close this unintended gap in coverage. The Senate bill number is S1315, and this legislation has 72 Senate co-sponsors and 337 House co-sponsors. Enactment of the Lymphedema Treatment Act is projected to save Medicare over $1 billion.
This would be a bill, so I can get it, because I was just getting you, and you really started to get right. No, you did very well. But this is a bill that would allow Medicare to pay for these important treatments. And the argument that is relevant, and you've made it very eloquently, is, hey, Medicare, you're going to save money, because if we had our gloves, we wouldn't be going to emergency rooms and the like. Okay,
yes.
Good.
Also, when I have tried to get insurance to cover these garments that are prescribed by my doctor, they need a code. And the Medicare has to
That's coverage.
Invent the code.
Are you receiving Medicare today?
No. I have insurance. It doesn't have a code. It is very difficult to get them to cover the garments without this code.
So would,
Billing code.
okay, yeah, this, I just, because this is kind of the area I specialize in, so I ask questions, I can kind of figure out how to move things along. So this is a service that makes a lot of sense. And are you interested in trying to extend this to all who have this healthcare challenge and are over 65? Or do you wish to have Medicare pay for it for people of any age who have this problem?
Everybody. There are plenty of children who have this problem. We all get cellulitis and we all end up in the emergency room because we need to have good fitting, high quality garments that can be replaced. I have to wear this. This is I'll show you.
How much do you?
This is the garment that I have to wear. Yeah.
How much do you think it costs to get the garments you need for a year?
Well, so I looked at how much I paid, and I paid $900 per garment, and that's out of pocket. And then I also have to wear a night garment, which I pay $430, and I have to wear this all the time. So I would love to have a garment for every day of the week. So I only had to do my laundry or to wash them, once a week. But in fact, now I have to wash them every night, or sometimes I wear it a few times and then wash it. And I'd rather have clean, fresh garments.
But I was just doing some math, ma'am. So if you're spending $1,330, which is the 900 plus the 430, and you need them for 7 days a week. So let's just see if we can get in 21. You're talking about under $10,000 a year. And even one or two of these emergency visits will be much greater than the 10,000. Okay.
You got it.
I got the math there. I will tell you, and what I do always when I hear something at a town meeting, I always say I'm going to under promise and see if I can be useful. And you've really got a good argument here. Now, a lot of my colleagues probably will say, hey, we're for Medicare. It says Medicare over 65, some exceptions. Well, what's Ron going to do? Is he going to start giving Medicare to people who are 16? Now, because I think this just makes a lot of sense to do it. The private insurance companies, is there any private insurance company in America who will give you 7-day-a-week coverage?
For these garments?
Yeah.
I've never seen it. We need Medicare to set a precedent for the private insurance companies. Right. I have actually had insurance that will cover 2 every 6 months, but that's not enough. And because they wear out so quickly. So do you have a private policy that covers for a year, 2 every 6 months? I currently have, so I was living in New York City until last year. And then I moved back to my hometown of Portland because of coverage problems. I had Oscar Health Insurance Company in New York, and they would not cover anything. Then I moved to Oregon because Providence covers 2.
Got it. 2 every 6 months for a year.
Yeah, 2 every 6 months.
Let me do this. You've made a very compelling case, and I've asked questions because I really wanted to understand it. We'll make sure folks from the Senate Finance Committee who specialize in health get back to you. Okay.
Thank you.
Thank you. Sorry that you're having to deal with this. It's like everything else. Healthcare is the most important thing. If you don't have your health, everything else goes by the board. So we'll get to work on it.
Thanks so much for joining us, Jamie. Next up, we have John.
Thank you, Senator Wyden, for hosting this. And I'm John Christensen. I live in Corbett. I remember attending one of your very first town halls as a newly elected congressman. I think it was 81 or 82 at the Kaiser Hospital on North Greeley. Goes back a few decades. So I thank you for your 4 decades of public service and holding these meetings. Today, my remarks are about forest carbon sequestration and the protection of old growth forests. And I want to thank you for being a signer of the recent letter written by several members of Congress to the Secretaries of Agriculture and Interior, urging them to protect and restore our nation's old growth forests as part of the Infrastructure Investment and Jobs Act. So thank you for that. In my opinion, these forests sequester enormous amounts of carbon. They play a considerable role in climate change mitigation, and they also provide enormous co-benefits in the form of wildlife habitat protection, protecting our waters, and as ancient beings, they deserve protection in their own right. My request to you today is as a small forest land owner. There are more than 70,000 small forest owners in Oregon, and collectively we manage 12% of the state's forest lands, which is about 3.5 million acres. Could the US government also provide technical assistance to us small woodland owners who wish to practice climate smart forestry? Recently, my wife and I enrolled our 79-acre forested property in a carbon sequestration program with the California Air Resources Board, which allows us to sell carbon credits on their exchange. And it seems to me that there ought to be a federal program of technical assistance to small woodland owners who wish to voluntarily participate in forest carbon sequestration for the common good, and in so doing also to enhance the resilience of their forests. So basically that's my request to you.
Very good idea. Now, you're in the gorge. Are you talking about having this program assisting with carbon sequestration help private landowners or government landowners?
No, this is for private small woodland owners. So, people that own maybe 1,000 acres or less. So I'm not talking about the Weyerhausers at this point, although I think any forests that can be protected with whatever resources is good for the planet.
So you would envision for small woodland owners a kind of service, say at the Forest Service or some such place, where they could advise small woodland owners on how to do carbon sequestration. It would be good for them, and it would also be good for the community because there would be an added measure of safety.
Right, exactly. Or it could be monies to help the Oregon Department of Forestry have the personnel available to do this.
Have you asked the Oregon Department of Forestry to do this?
Well, there is a bill was moving through the Oregon legislature, Senate Bill 1534, which was the Natural and Working Lands Bill. And it's been now, the leadership of the legislature decided to hold it back and not advance it this session. We were very disappointed about that. But it would have provided some technical assistance to people like us to do this. So it seems to me that multiplying these 70,000
and providing technical assistance to all of you as small woodland owners to do carbon sequestration.
Right, who wish to do that. I mean, it's a voluntary program, but and unfortunately, in the last couple of sessions, the Oregon was not able to pass a climate bill because the Republican senators walked out the session, denying a quorum to do that. But that would have allowed us to have the same kind of program as California and to participate in that. So there are some of us who have already started working with the California Air Resources Board, and I'd say there's a handful now in Oregon who are doing that. But anyway, I think that there's a lot of pieces to this, but perhaps the federal government, as part of the infrastructure bill or some other resource, could also help us to do our small part.
Now let me under promise and try to be useful. I'm very supportive of carbon sequestration as a general proposition. You may have picked up that my Clean Energy for America bill, which passed the Senate Finance Committee, is the principal vehicle now on offer for hitting a significant portion of the president's climate goal in reducing carbon. What I did as chairman of the Finance Committee is I took the 44 separate tax breaks for energy and I threw them in the garbage can. And I lit a fire on them so they couldn't come back. And instead of the 44, we would have 3 for the future. 1 for clean energy, 1 for clean transportation, 1 for energy efficiency, which we might even be able to get yours under, particularly the energy efficiency one. And this basically means that we'll do something that's never been done in the United States Congress, certainly in the Senate Finance Committee's history, which is no longer would we just be giving out tax breaks. We would say for the future, we'll be technology neutral, everybody can play, but the tax savings will be tied to carbon emission reductions, so that the more you reduce carbon emissions, the bigger your tax savings. That's where we get so far down the road with achieving the president's climate goals. He's very supportive of it as well. And so I am all in on this climate fight. I'm sitting adjoining our kitchen, looking at our front door. And last summer it was 115 degrees outside the door when I was sitting right at this table in my home in Southeast Portland trying to do some work. So this is not some abstract thing. This is really an existential challenge. Okay. Make sure you give Nathan a phone number and an email. We'll get back to you, but I'm very strongly in support of these carbon sequestration programs. Senator Manchin, who worked with us on this proposal and has had good things to say about it, is also very interested. So we'll want to continue that discussion with you.
Thank you.
Thank you.
Terrific. Thanks, John. We do want to get to 1 or 2 of the questions from folks online. So we have a question from Tristan, who asked Senator, and I'm quoting, "The invocation of emergency powers and subsequent seizure of protesters' assets by the Canadian government is highly alarming and unusual precedent set by a G20 nation. Senator, what will you do to ensure that civil liberties against unwarranted searches and seizures of property are maintained, especially during a perceived crisis?"
I think the person is talking about Canadian law and Canadian individuals. Am I right about that?
Yeah, I believe they're, if I'm interpreting, their concern is that could this happen in the United States, the seizure of assets of protesters?
Well, I'd certainly be against any kind of arbitrary seizure of assets of Americans, and I have spent a very substantial part of my time in public service trying to protect people against unreasonable searches and seizures. I have a major piece of legislation called the Fourth Amendment's Not for Sale, which basically involves people going around the requirements for searches and seizures involving people's data. So let's have the caller get me name and number in terms of of how to contact them. And I also mention another part of this job, Nathan, is battling bureaucracies. And I'm no stranger to battling, bureaucracies. We had one that had a happy ending about a week or so ago. Toledo, Oregon is a small, town, about 3,700, people on the coast. And about 15 people were likely to lose their homes as a result of a bureaucratic interpretation of an IRS rule. They lived in a set of dwellings where they always paid their rent. They'd never done anything wrong. But the IRS had determined the building was being run by someone who engaged in fraud, and they were going to take it back. And so the IRS said, we're just going to tell those people, despite the fact they'd been paying rent and complying with the Oregon tenants laws, they were just going to be out in the cold in the middle of the winter. So I said, I'm chairman of the Senate Finance Committee. I'm going to get the commissioner of the Internal Revenue Service, we'll get the Treasury Department on the phone. And I said, hey, this isn't right. These people haven't done anything wrong. And you guys need to recognize that this is a situation that requires that the Internal Revenue Service and the Treasury Department comply with Oregon tenant protection law. And after we did that and we negotiated an alternative, all those tenants, seniors and folks with young families, are being allowed to stay, and their rights are going to be fully protected under Oregon tenant law, as opposed to them just being put out in the cold in the middle of the winter. So we're no strangers to battling bureaucracies, and there's 15, I think, very happy people in Toledo who are glad they weren't put out in the cold in the middle of the winter.
Terrific. Well, hopefully that answers your question, Tristan. Thanks for submitting it. And we'll do one last question before we wrap up. And this is from Ward. And Ward asks, Senator, what's the status of Louis DeJoy and the administration's ability to remove him?
Yeah, let me kind of walk you through that. We have been trying to determine exactly what the status is of the DeJoy issues as well. I completely agree that he ought to go. Ever since he was picked by Trump as the postmaster, he lowered service standards and raised prices. He even tried to mess with Oregon's vote by mail. So I started calling for him to be fired in August 2020. Now, the glitch is the Postal Service isn't funded by tax dollars. It's not directly controlled by the Congress or the president. Only the Board of Governors can remove and replace the Postmaster General. So what I and others who believe that Mr. Joy is not acting in the public interest have said is we want the Board of Governors to remove Mr. DeJoy as postmaster. I'm an original co-sponsor of the Bipartisan Postal Service Reform Act, which would, going forward, make the Postal Service more accountable to Congress, shore it up. Despite DeJoy's efforts, it also preserves 6-day delivery service and ensures that the Postal Service is going to be strong for decades to come. That bill is going to the Senate floor for a vote next week or soon after. It's going to, in my view, go a long way to pass and save the Postal Service. It should have passed last week, but there was a little technical issue that really had nothing to do with the substance. But a bunch of Republicans who don't like the bill, and I guess like DeJoy and don't like the Postal Service, held it up. So we're going to get it passed next week. We're just going to have to run the kind of procedural gauntlet, but we're going to get it done.
Well, great. That is the last question we have time for. I do want to thank everyone who joined us for these video questions, everybody who is watching and commenting on Facebook and YouTube. This is Senator Wyden's last town hall before he heads back to Washington, D.C., I believe, in the next few days. And so much to do. But I hope these conversations over the last few days have been really valuable, informing that work ahead. Senator Wyden, thanks so much for joining us. And the last word is yours, of course.
Nathan, thank you. And to Oregonians, we should be so grateful to Nathan and People's Town Hall. And I want to repeat what sometimes they're a little bit too modest to point out. They throw open the doors to everybody. They've said, you want to be part of this? We don't care where in heck you are on the political spectrum. We're going to give you a chance to do this. And I just really appreciate that. And I appreciate People's Town Hall getting ready with us to be able to do things in person again. That's something that every time I think about it, I smile. And yes, I'm sitting at my kitchen table in Southeast Portland today. I'll be heading back to DC over the weekend, and the next town halls we're gonna be in Eastern and Southern Oregon. Coming up, that'll be in March. And I thought I'd just close by way of saying we've talked about a lot of issues today. Certainly. At this hour, we're dealing with very, very substantial challenges with Vladimir Putin in Russia. We didn't talk much about voting, but I'll tell you, I'm fighting with everything I got to keep people in Washington, D.C. from turning back the clock on voting. I'm the country's first mail-in United States senator. The second mail-in United States senator was a Democrat, a Republican. I'm Gordon Smith. And I think it shows Oregon has always been about bipartisanship on these big issues. Dennis Richardson was our Republican Secretary of State. He told Donald Trump to go fly a kite when he was interested in rolling back vote by mail. So Oregon's had a bipartisan tradition of vote by mail. That's what we ought to be doing in this country, is building on bipartisan approaches that will promote democracy. And we ought to use, and I'll close with this, we ought to use something that brings people together in what I call common spaces. That's what this is, folks. I think it's right at the heart of public service, and doing public service right is giving people a chance to come together, to be heard. People don't always, agree. Just yesterday, I had somebody who was asking, questions about my position on social media platforms. And I said, I haven't changed at all. In fact, just in the last week or so, Martin Heinrich and I blew the whistle on a program that most Americans didn't even know about, that was being run by the CIA. And we'll have more to say about that. So this is, to me, what makes Oregon special, is we come together, we share ideas, we share our views. I don't have all the answers, not by a long shot. I hope to see my family in a couple of hours, and they're always telling me, hey, you really blew it on that question. You should have said this and this and this. And often they're right. What I do know is what we have been doing this afternoon on a pretty day outside, bluebird blue outside my house. We're doing it the Oregon way. We come together. There wasn't a bad question in the House. This was town hall meeting number 1001. And as long as I have the honor to represent you in the United States Senate,